Welcome viewers and listeners to the COVID-19 update for today, March 25, 2022. I am Shania Gonzalez, and in today's update, we're speaking with the Minister of Health, Dr. Frank Anthony, about the ministry's plan to contain the virus if Guyana is to see another surge in cases.
Well, we haven't dismantled our system. Our systems are still there. Um, Hospital beds, we have ICU beds, we have them across the region. So if people need hospitalization, the systems are there to take care of them. And we've also, we still have our testing capacity. We're still providing testing to people who need testing. So the systems are all in place. We haven't dismantled them. Well, right now we're seeing a surge in cases in a number of countries. So over the last 2 weeks, the WHO has recorded a 9% increase in cases globally. And when you actually disaggregate the numbers, you're seeing most of those cases coming from the Western Pacific. But these cases does not represent the true number, because a number of countries have also not been doing wide-scale testing. So there might be some amount of under-reporting. And with the use of home kits, it is very difficult to capture the information from home kits, because when people do the tests at home, very often they're not reporting it. And if they don't report it, it's not going to be captured in the statistics. So these have been challenges in terms of surveillance going forward with the disease. But nevertheless, seeing a 9% increase over the last 2 weeks is significant. So the BA2 is playing a role. Generally, we would have a lag between when we see it appearing, let's say in Europe, in North America. Generally, there's a month or so lag, and then we will start seeing cases here as well. Again, it might be a little bit too soon to lift those mandates, but every country would have to make those decisions. And why I say it's too soon, because in the light of an increase now in global cases, we ought to be a little bit more careful in terms of how we lift the mandates and how fast we lift those mandates. Even when the numbers are relatively low, you can still have a challenge, because for persons who are immunocompromised, some of them might not be able to take the vaccines that are available, and therefore they'll remain unprotected. So the only way that they can be protected is if they wear a mask and people around them are also wearing masks. In addition to those persons, you would know that we really don't have a vaccine for children 5 years and lower. So that's a challenge as well. And in Guyana, we don't have for the 11 to 5 or the 11 to birth. So that's a challenge. So some countries have been giving vaccines to the 11 to 5, but most countries don't have access to these vaccines. So for small children, it is going to be a problem, because they remain unvaccinated because of the unavailability of vaccines. So again, one way of protecting them is to make sure that people wear masks. So that's another reason why we shouldn't be too quick in terms of lifting the mask mandates in your ranks. So in terms of vaccination, for adults, we've had 437,757 doses administered. That's first dose. So we're right now at 85.3% of the adult population. For second dose, we are 335,935. So that's approximately 65.5% of the adult population receiving a second dose. In terms of the ages 12 to 17, we have first dose at 34,246, or 47% of that age cohort, and second dose is 24,917, or 34.2% of that age cohort. The booster doses, we are now at 57,348 doses.
You have been watching the COVID-19 update for today, March 25, 2022. For more information, visit the Ministry of Health's website at health.gov.gy, DPI's website, dpi.gov.gy, and our social media platforms. I am Shania Gonzalez.